Hi, Dr. Ziegler with Lifestyle Solution. So in this video, the purpose of this video is to discuss what a VO2 max assessment is and who could benefit by receiving a VO2 max assessment. The video is not meant to be an all-inclusive educational piece about the hows and the intricacies of a VO2 max, but kind of a basic introduction. And we're more than willing to and happy to answer any other questions that you may have. So first of all, let's talk about what we mean when we say a VO2 max assessment. And I'll share my screen here with you so I can share what we're talking about. Okay, and so first let's talk about what you're going to expect when you come. So when you come in, it's similar to when you have your resting metabolic rate assessed. We'll strap a polar heart rate monitor on you. This monitor is going to go directly on your skin over your sternum so that we can see what's going on with heart rate. We also will put a mask on you that looks similar to this. And this mask goes over your nose and your mouth, and it's collecting expired air, expired oxygen, expired carbon dioxide. What a VO2 max test will require you to do is to gradually increase your exercise intensity, eventually to where you're exercising as hard as you can go. That's the purpose of this test. Now, the picture I have here is an assessment that I did on a friend of mine. An assessment does not have to be done on a treadmill. It can be done on a lot of different instruments. I tend to use a bike a lot more often because it allows us to take a measurement of blood pressure, and it's very hard to measure somebody's blood pressure when they're running full speed. So again, when we look at the definition of a VO2 max, when we look at this graph here, on the X, or the horizontal, we see that exercise intensity is increasing, and then on the Y, we can look at oxygen consumption. There is a very linear relationship between exercise intensity and oxygen consumption. As I work harder, I'm consuming more oxygen. Well, eventually, if you keep going and going and going, you'll not be able to take any more oxygen in. And that's by definition what we call a VO2 max. You've plateaued. So VO2 max is the maximum amount of oxygen that a person can take in and actually extract or utilize. Now, why is this important? Well, VO2 max for athletes has been shown to be a very good indicator of success in events, athletic events, lasting 1 to 3 minutes. It is also a good indicator of predicting success for athletic events lasting between 20 minutes to 4 hours. So what we're talking here are our aerobic athletes, those who run marathons, triathlons, Ironmans, those kind of events. The other reason that this is important when we talk about athletic performance is when we measure a lot of different variables when you're exercising. One of those variables is ventilation. So the total amount of volume of air coming in and out in 1 minute. And we also could measure lactic acid, and there's a lot of other variables. Well, we know if we look at ventilation, which is in the orange, ventilation will increase in a linear fashion with VO2. So as we're working harder, as VO2 increases, ventilation increases in a linear fashion. Well, there becomes a point across this exercise intensity spectrum where ventilation will increase not linearly, but exponentially. It will increase at a greater rate. At that point, and that's identified here on this graph by the respiratory compensation. At that point is what we call the ventilatory threshold. You may have also heard similar terms called the anaerobic threshold or the lactic acid threshold. They're not necessarily the same thing, but they occur at about the same point. The reason that that is important to note is because, as I said, the lactic acid threshold, which is shown here in this graph in blue, it occurs at about the same point. So blood lactic acid will remain relatively stable in the first part of exercise, but as intensity increases, lactic acid accumulates in the blood, and this is pinpointed here in this graph where it says point of ABLA, that stands for onset of blood lactic acid accumulation. When lactic acid starts to accumulate in the blood, that's when fatigue sets in, muscle pain, and performance will decrease. You cannot continue to exercise at the same intensity once you hit this point. So by knowing the ventilatory threshold, what we can do is we know that that is the intensity that you can train at. You might call it the sweet spot. You can train or compete in an event at that intensity for the longest period of time without undergoing fatigue. The goal of your training program would be to move this ventilatory threshold farther to the right, meaning the goal of your training program would be to increase this ventilatory threshold to where it occurs later on at higher intensities. Thus, you can engage in increased athletic performance and hopefully increase success in your desired sport. And so knowing VO2 max is very important for athletes, but it's not just important for athletes. It's also important when we talk about health indicators as well. VO2 max has become one of the strongest predictors of mortality and cardiovascular health and a lot of other health outcomes. But when we talk about mortality, here is a graph that has been taken from one of many research studies to confirm this. On the x-axis, which is the horizontal axis, we have different categories of somebody's cardiorespiratory fitness, which is the same thing as VO2 max. At the far left is less than 5, which should be considered the lowest group. At the far right, which is over 13, which would be the highest group. On the y-axis, this is the vertical axis, it's the risk of mortality. So we don't want our risk of mortality to go up. We obviously want that to go down. And what we see is as people increase their cardiorespiratory fitness, their relative risk of mortality decreases. And this has been done, replicated in numerous studies. And so even if your goal of exercising is not to increase athletic performance, we need to know this number so that we can know what your risk for disease and mortality actually is. Now, if your goal is to lose weight, okay, in our obesity clinic, this is important because we can see what you're using for energy as you increase the intensity of exercise. And so here on this graph, on the x-axis, we see exercise intensity as a percentage of either heart rate or VO2 max. And on the y-axis, we're looking at fat oxidation, or the grams of fat that we are utilizing or oxidizing per minute. So if we're in the business of losing weight, really we're not saying that correctly. What we really want to do is lose fat, right? That's the goal. So we want to not just talk about weight loss, but we really want to talk about fat loss. And so one thing that is important to know is what intensity of exercise should I be exercising at to where I am optimizing my fat oxidation, or meaning I am burning the maximum amount of fat that I can be. Well, the only way to get that number is by doing a VO2 max assessment and actually seeing through over the course of the exercise, actually seeing when you are burning the most amount of fat. And so this is what a VO2 max assessment can tell us. Now, as far as pricing, if you look over to next to this video, you can see prices, different prices if you're a member versus a non-member, and different prices if you get a resting metabolic rate assessment and a VO2 max assessment packaged together, then it's cheaper. Now, this VO2 max and these indicators that I talked about here, they all change over time. And so ideally, you don't just get a VO2 max done once. You would want to have this assessment done periodically on a monthly basis to where you can see if your exercise is actually achieving the benefits that you want it to. Then also we can use those numbers to tailor the program for the next month. If you have any questions, please do not hesitate to reach out to us through email, through phone call. You can message us on Facebook or anything like that, and I look forward to hearing from you.